insurance companies will readily approve a cesarean that a mom's scheduling for no medical reason. And we're like, help us here. You know, moms can just decide, I would prefer to do it this way. And so I'm going to go in, and that we believe that there needs to be some changes there. Of course, you have the right to choose how your baby is born, but this is a major surgery.
Yeah.
And the way that insurances decline all the things that people sometimes need, you let people have a major abdominal surgery. I would love to know the why behind that.
Yeah.
You know, what is happening here? One of the providers, remember, I service rural counties, so I'm working with maternal deserts, places where families have to travel at least 30 minutes to the nearest hospital or to have choice of provider. And one of the providers said to a mom who was requesting a VBAC, a vaginal birth after a cesarean, he said to her, honey, what insurance do you have? And she said, well, I have state health insurance. And he said, you're not paying for this surgery. My tax dollars are. So what is the problem? That is the mindset. That is the normal jargon used to communicate with women that look like us in these rural areas. There's no respect. They see the numbers behind it. And he asked her outright, are you paying for it? No, I am. So why do you care if I'm putting you on the books for surgery? Go away. That's normal. He didn't feel a single thing. That's how he communicates with clients regularly. And language is so important. We hear all the time, you're going to get a dead baby if you don't do it my way.
No.
She told her that multiple times. This mom at Piedmont Henry. Baby's going to die. The baby. And when I requested, like, hey, can we please not use that kind of language? Well, I'm just telling her the truth. If she wants to do it this way, her baby's going to end up dead.
Yeah. We hear that all the time. Or if a mother is overweight, they might say, well, what did you think was going to happen if you haven't taken care of your body? What did you think would be different in this situation? And it is hard to hear that and not flip tables.
Yeah.
We haven't flipped any tables yet. We keep
it
very classy.
We've been doing this work for 5 years.
We haven't flipped any tables.
300 plus births. And we have never been kicked out of a hospital, by the way, while everybody thinks we're belligerent crazy doulas. We're not.
You know, I look at this as, and like I said to you a little bit before, so when I got it, I'm a comment reader. I take time. I think some of it is funny. I think some of it is offensive. But when I saw people combating you all stories, they were all men.
Yeah.
That hurt me a little bit. It's getting to the point now where I feel like men hate women.
Yeah.
Like, I don't know where this comes from. Well, I have my hypothesis on it, but I'm not going to get into that.
Okay.
But it generally feels like men hate women. Do you have better success from women who are doctors than men?
I would say yes.
Yeah,
I would say yes. I've only had a few OBs that were, I only had a few male OBs that look like me.